Okay. Hi, I'm so excited to be here with all of you and all of my colleagues from New York City and New York State with all these incredible creative ideas. So thank you. My name is Bea Hansen. I'm the director of the New York State Office of Victim Services. Through our staff and 250 organizations that we fund, we support hundreds of thousands of victims of domestic violence, sexual assault, human trafficking, gun violence, and other crimes all across the state. And the purpose is really to help them heal and rebuild their lives. Most of the organizations we fund and most of the work we do is right here in New York City. Yet one victim of gun violence recently told me that we're the state's best kept secret. And we don't want to be a secret. So we compensate people who've been victims of crime. We recently expanded the number of organizations that we fund to make sure that we're in the communities that are most impacted by violence. We recently implemented new laws and changes in procedures to enable more victims to access our services and to reduce their out-of-pocket expenses. We have very little research and evaluation capacity, and so that's why we're here today. We want your help to evaluate the work that we've already done and to dig deeper to better understand what other gaps in services we need to prioritize. So I'm going to pass it over to my colleagues to talk more about our specific pitches, and Katie Egglesfield is the first one up. Katie.
Hi, good morning, everybody. So OVS can provide direct reimbursement to victims and survivors of crime for their crime-related out-of-pocket expenses. Until December 2025, OVS needed proof that a victim reported that crime to law enforcement before determining whether someone was eligible for that kind of reimbursement. Longstanding public health theory assumes that people need their basic physiological and safety needs met to be able to think beyond those needs and move forward with re-engaging with their community and improving their mental well-being. So in a lot of ways, we've been expecting people to engage with criminal justice entities and other social systems that require in activities that require a high degree of executive functioning before they've had those basic physiological and safety needs met all along. So, but that's not to say that we don't believe in the importance of government and nonprofit systems working together to reduce crime and prevent re-victimization. So OVS is interested in learning more about the temporal aspects of receiving victim compensation. What are the factors associated with people engaging with law enforcement and applying for victim compensation? Are there differences in the psychological and psychosocial outcomes among New Yorkers who receive victim compensation? And what, if any, are the differences between those who receive it before or after engaging with law enforcement or other entities? Did people who receive victim compensation first before engaging with them end up engaging in the end? And if so, to what extent? We have decades of data, I think, like many of you here, and connections with victim service providers and criminal justice agencies. We're looking forward to working with a researcher who wants to help us understand our population better so that we can create tailored messaging and programming to increase the number of victims and survivors who seek financial support from the Office of Victim Services. While it would be helpful to have experience with criminal justice data, one of the things I love about working in the victim services field is that it straddles public health and criminal justice systems. And this is a unique opportunity to do that kind of interdisciplinary work. In terms of impact, New York is a great place for us to start because almost half of the victims and survivors who come to us statewide are from the New York City area. But as a state agency and as part of the team who would be responsible for implementing these programs and interventions, I can confirm that the results of this study would be applied statewide. The outcomes of this work have the potential to be applied to other programs across the country as well. And although there are researchers and program evaluators all over the country doing great work in the victim services field, most compensation programs like ours lack the capacity to do this kind of research, but are always looking for practical information about how to increase visibility for their programs and the rationale for loosening longstanding requirements. So looking forward to working with some of you. Thank you.
Hi, everyone. My name is Melissa Paquette. I'm General Counsel at the Office of Victim Services, or OVS. It's nice to be here with you all. As Bea mentioned, OVS funds about 50 victim service providers in New York City. One of our goals at OVS is to fund victim service providers who are culturally responsive and who are serving historically underserved communities. Another of our goals is to make sure that victims who do not work with law enforcement, don't feel safe reporting to law enforcement, are still receiving the services they need and understand that victim compensation through our office is available to them. Nationwide, we know that about 50%, less than 50% of crimes are reported to law enforcement every year. And we want to make sure we're also reaching the survivors who don't feel safe reporting to law enforcement. And that can be for a variety of reasons. It could be fear of retaliation. It could be not wanting the person who caused them harm to be arrested or be engaged in systems. And it could also be because there's a lack of trust in law enforcement for a variety of reasons, especially among marginalized communities. And we also know that historically, populations who may not feel safe reporting to law enforcement could include LGBTQ plus survivors of crime, Black and Brown survivors of crime who are victims of sexual assault or domestic violence. And these are people who we can reach, who we can serve, who we can provide victim compensation to, and whose families we can support through that care. So we are looking for your support to identify, are the programs that we at OVS fund serving all survivors of crime, regardless of whether they report to law enforcement? We're asking you to help us find out, are our funded programs reaching all the demographics in New York City, which is everyone impacted by crime? And are our victim services providers serving victims who are in those categories who may historically feel unsafe reporting to law enforcement? We're looking for someone who has experience in criminal justice data. We're looking for someone who's interested in giving us research that could really impact how we structure our funding and how we fund victim services in New York City to improve the care that New Yorkers receive after they've been impacted by crime. Thank you so much.